Hi, I'm Dr. O.
And I'm Dr. Amy.
We're both certified animal chiropractors. We're certified by the American Veterinary Chiropractic Association.
We're also veterinarians. We both went to veterinary school at accredited colleges.
And today, we're fortunate enough to be here in Wiley, Texas at Double B Equestrian Center. And we'd like to thank Rick and all the boarders that are gracious enough to let us work on their horses today. Hi, I'm Dr. O, and today we're going to look at a performance horse. This is a barrel racing horse we're going to look at today, but any performance, no matter what your discipline is, can benefit from chiropractic care. This guy ran 3 weeks ago. He's competing in the top level of open barrel races. Just not quite given the competition that his owner thinks he should be able to give her. And so we're going to take a look and see maybe if we can't find some chiropractic problems that we can correct and help this guy bring out the best in himself and his rider so that their performance is going to be better. And remember that these little things, when the horse moves, it takes every muscle, every ligament, every tendon, every joint, and every bone in their body to move. And so if we have a problem in one, it gets compounded. And if we don't take care of these, then eventually we'll end up with some problems like in the lower limbs. We'll end up with some problems maybe metabolically that are going to end up with maybe early retirement for this horse. So what we're going to do is we're going to take a look at this guy and introduce ourselves to him. And I just have a food treat here. And we're going to see how well he likes it. We're going to try to get him to eat off his shoulder. And remember, a horse is a prey animal, so they should be able to come around 360 degrees and get this treat. And as you can see, he's just not quite able to do that over here. He just can't quite get it. So let's turn him around, and we'll try the other side. Okay. So we have the same treat. And he just can't quite get this one either. So we know he's having some problems with his neck. Now, let's go around over here. Stay right, keep him right. And we'll take a look at his back. Okay. So, his back should bounce. And when I put pressure in top here, you can see that his belly bounces. Okay. When I come back here, which should be the most fluid area of his body, and I put pressure there is no bounce. His body doesn't bounce like it should. So we know he has a problem here with movement. And if I ask him to collect, what I'm going to do here, this is a reflex action. So when I get hit with a rubber mallet, my leg kicks. And it's automatic. It's not that it hurts. It's just a nervous system reflex. When I tickle him right here, he should collect. And he's trying. He's real uneasy, and he's not coming up very high. So that means that he's very inefficient in transferring energy from his back end, where the energy is generated in a horse, and it has to travel out the front end. And when this lack of movement in here makes that very inefficient. So even though he's been doing great, he's doing his job, he's performing on an everyday basis like he should be, he's got several problems that we can probably, hopefully, take care of with chiropractic care that will help him perform even better. So let's go adjust him, and we'll be back in just a minute. Okay, we went and adjusted this guy, and hopefully with the adjustment, we're going to be able to see that his head's moving better, his neck's moving better, the joints in his spine are moving better. This is going to help him because, remember, this is the steering wheel. Where the nose goes, the body follows. So if he can't turn around, like earlier we showed you, how can he turn a barrel? If he can't turn his head all the way to the left, how can he follow a calf? How can he do a tight reining pattern? How can he do some side passes if the head and neck won't move? Then as we move back, if his shoulders don't move correctly, how can he carry you? How can he stop? Because he needs to carry 65% of his and your weight on his front end. So if those shoulders aren't moving correctly, then he's not going to be able to carry you correctly.
Dr. Bill,
Yes.
how is a chiropractic adjustment going to make him move correctly?
Well, by helping each individual joint in his body move correctly. Remember, when the horse moves, it takes all of his joints to move correctly. When we move, we can move from our pelvis down. We don't have to move our whole body. But if his front end isn't moving, then by definition, correctly, his back end can't move correctly. Okay? If his head doesn't bob right, then his legs can't move correctly.
Okay, so how's that going to improve his performance rate?
Well, by helping him move better, it should help him. If his stride is short and we increase it even by a couple inches, okay? If he's running 100 feet in a,
Is that going to improve how he breathes?
it'll improve how he breathes because hopefully we adjusted his rib cage, so his ribs are moving better. So he'll be able to breathe deeper and easier. It won't hurt when he breathes.
What do you mean, hopefully?
Well, we never know until after we adjust these guys. Every animal is going to respond differently, and we need to remember that. And
What if he has underlying other issues? How's the adjustment going to help?
will still help him. It maybe not 100% like in some horses. Some horses, one adjustment, boom, they're good to go. Some horses, one adjustment, they're a little better. An adjustment 2 weeks later, they're a little better, and they keep routine chiropractic care, and they get better and better, and then you just fine-tune them every time. Some guys have some underlying pathology. We may see that they have some GI pain. We may see that they're acidic from their diet.
Can chiropractic fix that?
Chiropractic can't fix it, but it can sure help. And it will make him feel better, but it won't make him 100% until we correct those underlying issues. We change his diet.
So if he's got underlying issues, why bother chiropracting him?
Because it's going to help prevent those other underlying issues from getting worse and taking over. We can keep those underlying issues at a low boil until we can get those corrected. We can help them from getting worse. Okay? So what we're going to do, and remember that chiropractic isn't necessarily about the bones. We work on the bones, but chiropractic is a neurological, and we help the nervous system when we adjust these horses. So
you
we
know
help
what
the
I
info.
tell my clients, Dr. O? The bones are just handles to the brain. That's what I tell my clients.
That's correct. And so what we're going to do is we're going to adjust this guy. We're going to help his nervous input to his gut, to his lungs, which is going to help him breathe easier. It's going to help him digest his food better. And hopefully then that's going to help him perform better.
How did his adjustment do?
His adjustment did pretty good. We're going to see that he's got a lot more movement, especially in his neck here. We can come all the way around. And now we can get that treat off this shoulder. As well as, if we turn him a little bit, we can get this treat off of his other shoulder. Now he should be able to turn those barrels a lot tighter than he was before. Because look at how tight he can turn. So he can now go 100,
Can you check
360.
his flexion?
Yeah. And we're going to do a couple things here. First off, we're going to look at his back bounce. And we'll see that his bounce is good all the way through now. Okay. As we bounce him, he now moves all the way through. Okay. And right in here where he didn't move before, his bounce is very good. Okay. So now he should be able to transfer motion. However, if his gut hurts because he has a low-grade ulcer, because his diet is incorrect, we won't be able to get the collection that we'd like. So this reflex here, you're going to notice that he still goes higher, but that is not comfortable for him yet. So see how high he goes, but he wants to walk away. So routine chiropractic care in these performance animals, especially when we couple it with proper diet and nutrition and an exercise program, will really help us get the best out of our horses.